So as we find our significant others and start having a family, certainly, as far as I know, kids don't come with manuals, so questions do come up, and one of the most common ones is, when should I start bringing my child to the dentist? We start seeing kids around the age of 1. By the time they're 2.5 or 3 years old, their full primary dentition is in, all of their baby teeth are in, and then we want to start seeing them on a routine basis. I would say that every 6 months or so is appropriate for children with no issues. Monitoring development, making sure there's no unsuspected problems that we can nip in the bud. And by the time they're 6, then things start changing and you want to monitor growth and the change of baby or primary teeth to adult or permanent dentition, and be able to guide parents on what's appropriate and what isn't. So a typical first visit, like I said, is more of a just checking and making sure that everything's okay. And often we may not even bring the child into one of the treatment rooms. We may do it in the reception area or the play area, because every child is different. Some kids are playful and curious and they're all up in new things, and there are other kids that are a little bit fearful, especially when the parent may use the word doctor, right? Because they know that going to the doctor doesn't often lead to pleasant, fun things. They might need to get needles or shots for vaccinations or some such thing. So when they come to the doctor, and in this case the dentist isn't the same as going to the physician, we want to make sure that they're at ease and comfortable in the dental environment, and they know that this is normal and routine for someone to be looking in their mouth periodically. And that's why we also want to get them into the habit of brushing regularly every morning and every night. And often as kids get to that 2.5, 3-year-old stage, they want to be independent. They're striving to assert their independence and they want to do that themselves. So I tell parents, let them brush on their own, but then mom or dad should be checking and seeing what kind of a job they're doing and kind of go over it. And we teach parents how to do that for their children, how to brush their children's teeth so that they have healthy mouths. And we invite parents to be in the room with their child. I prefer it because that way we can engage the parent in the child's care, and the child is more comfortable with the parent present, and everybody is trying to work together in the best interests of the little person. What we want to do is educate the parent about proper child care so they can avoid some common pitfalls that create havocs in children's mouths, such as nursing bottle caries or rampant decay in their child's teeth that causes a lot of problems for the child and requires extensive treatment. Thanks so much for watching. I hope you found this helpful. Keep on sending in your questions, and I'll see you next time.